And we can think about how oppressed people interact with systems that they don't feel safe in, and how that can lead to health neglect. And a good example of that is ICE presence near health facilities. So someone who doesn't need to be undocumented themselves, but they live in a household with undocumented people, and therefore they're concerned of bringing that attention to their household may keep them from seeking health care. Another way that reproductive oppression plays out is in violence, and not just intimate partner violence or stranger violence of a sexual kind, but also just violence. Violence against people who can become pregnant. Violence experienced in the communities of people that can become pregnant. There is research that shows that even if the person who was pregnant was not involved in any way with the violence that they learned of or experienced secondhand, it still has impact on their health and on their pregnancy. And then mass incarceration. Women are increasingly being imprisoned in jail, and this disproportionately impacts Black women and other women of color. So what happens when the person who's the backbone of the family goes to jail? What happens when a child's mother goes to jail? So all of these things work together to create a picture that helps us understand that, as healthcare workers, we can create the best healthcare ways that we administer things to help people improve their health and lives, but it means nothing if they can't access it. And so this slide helps me start a conversation with you about forced actually meaning. I'm going to keep this slide here, but I advance it too quickly. So I want to go a little bit more into forced birth. Okay. And so we're having this conversation within the context of a recently released report from the CDC about maternal mortality reaching its greatest height since 1965. In the data points back to 2020. And that Black women were disproportionately impacted by maternal mortality. And this is something we already knew. Those of us who work in healthcare and people who pay attention to when these breaking news comes out, Black women die in childbirth 3 to 4 times more than white women. So this is what we knew. But then we also know now that since 1965, we've been seeing an increasingly and alarmingly increase in maternal mortality, which is unheard of in so-called developed countries, so-called affluent countries. And it is getting worse. And in the backdrop of this, we want to force people to continue pregnancies. And so, why do we see the disparities that we see? It points back to our history. We have to start back with the chattel slavery system, where enslaved Black women were forced to have sex with people against their will to create a product to improve the economics of this country. They had no control over who they were partnered with. Rape was often involved in this. And so even with the end of slavery, with the Emancipation Proclamation, and the sexual violence against Black people continued, with lynching, which often involved rape and mutilation of genitals. And then we saw where there were starting to be some laws around that it's not okay to assault someone sexually. But those laws were not applied to Black people. And then we moved forward endured the treatment. And the legacy of those things still are with us. And so now to this slide. What this slide is showing you is the eugenical sterilization map of the United States in 1935. So what you're seeing here is that the states that have the strikes are the people who are the states, that had laws in effect January 1st, 1935. And then the black were states that had bills pending as of January 1st, 1935. So as you can see, the entire country was participating in the eugenic sterilization of Black women and other people of color. And this was so popular that by 1970, Black women were sterilized at over twice the rate of white women, 9 per 1,000 for Black women compared to 4.1 per 1,000 for white women. One Princeton University study found that in 1970, 21% of married Black women had been sterilized. The state-sponsored eugenic systems were forced on women of color either without their knowledge or with the threat that something could be taken away from them, like their benefits, like their children, like their liberty. And so those state-sponsored eugenic programs were halted in 1977. And by then, 100,000 to 150,000 poor, mostly Black women have been sterilized each year in the United States under these federally sponsored programs. And before I go on from this slide, I want to also mention coerced contraceptive practices. And so what we saw happening was we had the death of Rivera shot, we had interview devices where there were public funding for people to receive implants and IUDs. But then the same funds weren't available for them to have it removed should they change their mind or not like the method. So then you had people's ability to procreate taken away from them because they had these devices in place that they couldn't be removed because they couldn't afford to get it in the first place, and now they can't remove to get it. They can't afford to get it removed. And so this is particularly distressing because we know the liberation that occurs when people can uncouple the act of sex from pregnancy. And the ability for people to control their fertility is so important in people's ability to have autonomy over their bodies and their lives. And so the weaponization of contraception against women of color is just one other thing that's in the room with us as healthcare providers, or people who advocate for contraception, that is in the room with us when we're having these conversations. And there are people who we interact with who may have someone in their family who is still alive or endured these abuses. And so understanding that reproductive oppression can affect women, girls, femmes in multiple ways, there is a multiple approach to address it. And it's important. We have 3 basic frameworks, and all of them are very important in fighting reproductive oppression. So the framework that is most basic to us is reproductive health. And so reproductive health focuses on the provision of services to individuals. And then we have reproductive rights, which mainly is addressing the goal of protecting our legal rights to reproductive health care service. In particular, when we're talking about reproductive rights, we're talking about abortion. And then we have reproductive justice, which attends to movement building and intersectionality. We're looking at how systems of oppression intersect and create unique issues for people who are situated at multiple margins. And so this gives us a broader lens through which to see decisions that people are making about their health and lives, and how what's happening in their surroundings, in their communities, in their families, in society is impacting the decisions that people are making. And so I'm going to read a quote that I adapted from Loretta Ross. She said, "The ability of any person with a uterus to determine their own reproductive destiny is directly linked to the conditions of their community. And these conditions are not just a matter of individual choice and access. For example, a person cannot make an individual decision about their body if they are part of a community whose human rights as a group are violated, such as through environmental dangers or insufficient quality health care." And so, with the reproductive justice framework, we understand that reproductive health issues cannot just be centered on the individual person. It can be separated from the interlocking oppressions that are happening globally, as well as locally and nationally. And often due to the inequitable distribution of resources and community power. And in order for us to address these oppressions, then we need to have a multi-movement approach, right? We can't continue to silo our movements and work separately, because everything that we care about is interconnected. And in that vein, the way forward is to see the human right to abortion through the lens of reproductive justice. So we're not policing whether or not someone should have an abortion. We're changing the conversation of what should a birth occur. Does the pregnant person have the resources to feed, clothe, house this child that will be birthed? Do they have access to health care? Do they have a living wage? Do they have a social safety net that would help support the care if they have a disabled child, for example? These are the questions that we start to ask. Do we have educational opportunities? Should someone have a child with special needs? Are we actually creating the conditions for people to parent with dignity? So when we take the discussion away, and actually I wasn't going to say this, but I thought about this just now. I was talking to a patient recently, and she was really stressed out over the decision to have an abortion. This would be her fifth child. She has a lot of personal self-esteem issues, familial things going on. And in that moment, like, she's crying and she's stressed out. And she goes, "Well, I don't know." I said, "Why are you crying?" She's like, "I don't know if I'm going to do it." I was like, "Well, do what?" She's like, "Have an abortion." I was like, "Well, the conversation I want you to be having with yourself right now is, do you want to have another baby?" Because that's where you're going to get to the real understanding of what the right thing for you is. The decision to have an abortion, let's take that off the table. This is about to be your fifth child. And you have one that you're parenting with autism, nonverbal. And you're spending a lot of time with that child. And that's your first one, there are 3 others. So these are the things that this is where we want to take the conversation. Should a birth even occur? Not whether someone should have an abortion or not. And so that's the difference when you change the lens from which you're thinking about this and having a discussion about it. And so let's talk about, just so we have the tenets clear, reproductive justice is the right to bodily autonomy, the right to bear children, the right to not bear children, and the right to parent children in safe and sustainable communities, for the sake of this beautiful chart, I call it parenting with dignity. And this term was created in 1994 by a group of women who were, Black women who were come together to attend a UN conference, and they really wanted to call to question that movement at the time around reproductive rights was really about people, women specifically, with privilege, honestly, wanted to have the choice to bear children or not. And then you have women of color who are fighting to have and keep children. And so really wanting to shine the light on those concerns as well as whether or not someone can have an abortion or not. And so let's talk a little bit about, do we provide the conditions for people to parent with dignity? So I'm going to read something that I took from Supreme Court Justice Alito in his opinion on Dobbs versus Jackson's Women's Health. And this opinion gives us some clues around who matters and who doesn't when we talk about mothers, parents, and families. And so in his majority opinion, Alito argues that modern developments made past burdens of motherhood obsolete. These attitudes include developments include attitudes about pregnancy, the pregnancy of unmarried women that have changed drastically. The existence of state laws that ban discrimination on the basis of pregnancy. And the fact that the cost of medical care associated with pregnancy are covered by insurance or government assistance. He also brings up state aid laws that allow mothers to drop off babies for adoption with little reason to fear. And federally mandated family leave policies that protect jobs. So in Alito's imagined world, mothers and parents are respected by society, have secure jobs, adequate health insurance. And government mandated time off to raise their families. That's not this country. There are some countries that do that though. Why aren't we one of them is a good question. And what is not stated though is, but clear, that these are white, cisgender, female mothers, Christian families that adhere to heteronormative patriarchal standards. That's what all this is about. That's what a lot of these laws are about, right? And so the reality is very different for many people. So let's talk about single mothers. So 1 in 3 children in America grow up in a single parent home. And there is still lack of support for affordable child care. Now, I believe that maybe when Biden supports the Build Back Better plan as part of infrastructure, they try to sneak in there some universal child care. But, some folks weren't having that. And interestingly, I picked up this tweet from then Republican candidate for Ohio State, J.D. Vance, who then went on and won his election. Universal daycare is class war against normal people. Who are these normal people that J.D. Vance talks about? Yeah, so we have a long way to go to help parents take care of children that we are increasingly forcing them to birth. On family leave. So 1 in 4 workers have paid family leave. And no surprisingly, they're generally workers with higher paying jobs. And just in case you didn't know, the Federal Family and Medical Leave Act guarantees 12 weeks of unpaid family leave. And so we also see that Black and Latinx workers have less access to family leave, whether paid or unpaid, because it's very important. They generally have more paying jobs, and it's very important for them to work. And let's talk about access to health insurance. There was a study that showed in 2020, researchers found that in all categories of racial, ethnic, minority women experience higher rates of uninsurance than white non-Hispanic women. And this was significant. 75.3% of white non-Hispanic women were continually insured, compared to 55.4% of black non-Hispanic women, 49.9% of indigenous women, and 20.5% of Latin and Spanish-speaking women. There are some policy intersections there, right? Do I hear Medicaid expansion? Do I hear expansion of Medicaid postpartum coverage for a year? Those are some clear, you would think, bipartisan ways to improve this statistic. And so I talked about rights to bear children, rights to not bear children, and I wanted to speak to bodily autonomy. And so initially, when the reproductive justice term was coined, it had the three tenets: the right to bear children, not bear children, and parent children in a safe, sustainable community. Bodily autonomy was then added as we started to hear more queer voices of LGBTQ people within the movement. And it's a simple but radical concept. It's a simple but radical concept that individuals have the right to control what does and does not happen to our bodies. When we have full bodily autonomy, we not only are empowered to make decisions about our health and future without coercion or control by others, we also have the support and resources necessary to carry out those decisions. So this really ties in the importance of understanding that the conditions need to be met by society to allow us to really decide if, when, how we want to add to our families or not, have children, the families that we want to create, the ways that we want to present ourselves in the world that allows us to be our best selves and to thrive, not just survive. And these are not just a matter of individual right to privacy. It's not just a matter of individual choices that people make. Because one of the things that's really important to understand is behavior is a reflection of interactions with our environment. So yes, a person has autonomy to make a decision in an attempt to act on it, but who they are, what they look like, where they live, has an impact on, one, the decisions they will make, and two, whether they can actually carry them out. And so I'm going to get on my soapbox and say a few things. A patriarchal society steeped in white supremacist values has a interest in upholding a vision of a white, heteronormative Christian family. And therefore, people who do not fit that mold suffer rightly. Suffer in poverty or denied autonomy of their lives rightly because they don't fit that vision of normality. This justifies withholding resources. This justifies being okay with people dying. Anyone outside of this Black, trans, are left behind as unworthy. So when we're asking people to have empathy, their values don't even allow for that. Because in their mind, if you don't fit this vision, you are not worthy. Why should we even have empathy for you? So the thing is, like, we have to take what we believe is right. Because there is no negotiating with people who don't even see your humanity. So beyond Roe, on the left hand here, I have the tenets of reproductive justice, bodily autonomy, the right to have and raise children. And I think a little bit differently because the way words matter, right? So we have the ability to have and raise children. This is not about birthing them. We need to be able to raise them. And then the ability to raise children in safe environments, which is not a condition that is met in many communities. And so on the right here, I have some intersections. So access to an expansion of medical and social services for families. That would help a lot in raising children. Environmental protection, transportation access and safety, housing security and affordability. That would be helpful in helping to raise children in safe environments. Access to and affordability of nutritious food. My goodness, families are feeding their kids off McDonald's because it's cheaper than buying fresh people. They didn't even have access to fresh food at the grocery store, but in those who have a grocery store near where they live, they can't even afford the food. I was born and raised and trained in Los Angeles, California, and when I go back to the community I was raised in, I was like, oh my gosh, like, how did we even thrive? There was one grocery store that didn't have fresh produce, and we got like toiletries from there, and like everything from that one grocery store. And if you wanted to have really good produce, you really had to go pretty far out of the community. Like, I don't think I would. When I was out on my own, like on my own place, when I was in college, the first time I went to a really nice grocery store, I was in awe. I like walked the aisles with my cart for like hours. Oh my God, look how red that apple is. Yeah, so we ask a lot from people who have a little. And then when people with a little are given a little, then there is this expectation they're going to be so extremely grateful for it. In order for us to meet the challenge, then we also need racial equity, pay equity, and gender equity. Those are conditions that need to be met for all of these things to be true for people to actually be able to thrive and not just survive. And so I invite you to start to think of a broader vision. What type of policies could we create if we shine a light on people's actual lives? And how those lives could be re-envisioned within the framework of a value-led society. I have a reading list. Of course, this is the end all be all, reproductive justice, but I looked at it in kind of like 3 buckets. So just understanding the framework a little bit more holistically is feminist theory from margin to center by Bell Hooks. Bell Hooks intentionally keeps the first letters of their first and last name lowercase. And then when you think about abolition and criminalization, killing the Black body, raised reproduction is a means of liberty by Dorothy Crawford is a pivotal work to read. And then we're thinking about social reproduction theory, the right to sex, feminism in the 21st century by Amia Strand and Lessman is a good one there. And before I take questions, I have some calls to action for you. One of the things that I like to do, which we'll do if it comes to my workshop, when we have more time, is to actually have people sit with information that's been received in this talk and start to do some reflection. And so if you won't be able to do the workshop, definitely set aside some time to critically reflect on what you learned, interrogate values that you have assimilated without truly interrogating, about people and communities you interact little with or not at all. These isms are the air we breathe and the water we drink. Commit to learning more about reproductive justice and apply a justice lens to your work and your activism. And commit to centering the needs of traditionally marginalized people and communities in your policies and programs. Thank you very much.